Hi, I'm Kathy. I get a lot of questions about attention deficit disorder. It is something that most of us work with. I know that I sit in on a lot of IEP meetings helping teachers accommodate kids with attention deficit disorder. One of the things that you want to think about when you're working with children who have ADD is there's actually two components to it. If you've been to my workshop or you've read my book, you're probably familiar with the fact that there are two primary areas of the brain involved in attention deficit disorder. By the way, attention deficit is a genetically inherited condition. It does tend to follow paternal bloodlines. The primary cause of it is that the neurons in this hindbrain area lack enough receptor sites for the chemical dopamine. And so our big primary area for attention deficit is in the hindbrain. But there's a second area. The hindbrain has to do with sensory stimulation, being overwhelmed by too much stimulation, too many things. You're just overwhelmed, you shut down, sorting through stimuli. That's what the hindbrain is in charge of. But the second reason that many people forget about is this area right here behind your forehead called the prefrontal cortex. This region of the brain has to do with organizational skills, executive functioning skills, and both of these components are involved in attention deficit disorder. I think it helps a lot if you're working with these young people if you stop and look at them individually and ask yourself which of these two pieces is the more involved in that particular child. You've got the child whose primary problem is they're overwhelmed by stimuli. This is a hindbrain area. This is the child that if you give them a box of 64 crayons and ask them to choose one out to color with, the whole box gets thrown in the air because they cannot make a decision of one out of 60. It's just too much stimuli. When you're working with these kind of kids, you physically can manipulate their environment to limit stimuli. You don't hand them a box of 64 crayons. You don't give them a choice of 17 assignments. You don't fill the classroom with a lot of things for them to choose from. You need to limit visual and auditory stimuli. Make sure you've got visually quiet areas of your classroom. You've got orally quiet areas of your classroom. Physically limit stimuli. Then you have the other child who's more involved with the prefrontal cortex issue. This is the child that really needs help with organization. This is the kid that if you actually handed them the green colored pencil or the green crayon to use for the assignment, by now they've lost the assignment. They don't know where it is. They've lost their shoes. They don't know where their notebook is. They have absolutely no organizational skills at all. For this kind of child, you're going to be working on setting up an organizational system for them. And please be very careful not to assume that whatever system you personally like and you find keeps you organized must work for everyone. One of the biggest problems if you're working with kids, particularly in the middle grades, these organizational planners that our middle schools all send out to all of our children. Organizational planners actually are really only good organizational tools for people who are already organized. For children with an attention deficit, these planners can be tremendously overwhelming. They're full of a lot of stimuli. All the pages look the same. There's a lot of extraneous information going on in these books. They're very hard for many, many children to utilize effectively. So you want to try to offer them a planner as one option, but let's look at some other options for them. I like to encourage them to use maybe just a sticky note on top of the book to put the assignment on. They might want to text it into their cell phone if they've got that. Even some kids take a Sharpie marker and write it right across their hand. It may seem like a goofy way to keep track of your assignments, but at least the hand goes home with the child and they don't lose things. So give them 4 or 5 ways to try to keep organized and help them find what kind of organizational scheme works for them personally. And it may not be the organizational scheme that works for you. For more information and more ideas, go to brains.org.